Gary Fixter Patellar Tendinopathy in soccer. Gary Fixter Patellar Tendinopathy in soccer, also known as jumper's knee or patellar tendinitis, in the past, is a fairly common injury, especially in young players. This injury tends to appear frequently and forces the player to withdraw from the pitch. Even in some cases, if not treated correctly, the pain can become chronic. We explain below some of the most relevant aspects. Patellar tendinopathy in soccer is usually caused by an excessive increase in load, and usually causes pain. Diffuse or local inflammation may appear and prevents play on many occasions. Prevalence. It is true that patellar tendinopathy in football is not usually as common an injury as other lower limb injuries, for example injuries of the anterior cruciate ligament or meniscus, or as in other sports such as basketball or volleyball, although in the latter years the incidence in recent years has increased. Some studies such as Bode's in 2017 show that this injury is more common in young players, affecting approximately 2.4%, which represents an incidence of 0.12 injuries per 1,000 hours of play. Gary Fixter risk factors. There are numerous factors that can be considered risky in the development of patellar tendinopathy. We can divide them into risk factors intrinsic to the player and into extrinsic factors. Within the first group, intrinsic, the following stand out: alteration of the alignment of the lower limb, angle Q, alignment ASIS with patella and patella with anterior tuberosity of the tibia, patella alta, dysmetria and flat or cavus foot, among others. In the second group, the excessive workload stands out. While others such as uneven terrain, boots, material used in training etc. can negatively influence the development of patellar tendinopathy in soccer. Severity of injury.